What we are learning about COVID-19 in kids. To view the full article, click the first link in the description below. Back in April, the French epidemiologist Arnaud Fontanet found himself leading an investigation in the town of Crpy-en-Valois, a small community of 15,000 inhabitants just to the northeast of Paris. In February, the town's middle and high schools had become the center of a new outbreak of COVID-19. Fontanet and colleagues from the Pasteur Institute in Paris were tasked with conducting antibody testing across Crpy-en-Valois to understand the extent to which the virus had been circulating. As they surveyed the town, they noted an interesting pattern. While the virus had spread rampantly through the high school, with 38% of students being infected, along with 43% of teachers and 59% of non-teaching staff, the same was not true for the town's 6 primary schools. While 3 primary-age pupils had caught COVID-19 in early February, none of these infections had led to a secondary case. Overall, just 9% of primary-age pupils, 7% of teachers and 4% of non-teaching staff had been infected with the virus. These results showed us that teenagers are just as contagious as adults, said Fontanet. But in the younger age groups, it's a different story. They do not seem to transmit it to the same extent. Similar findings have emerged elsewhere. A new epidemiological study of 65,000 people in South Korea, which traced contacts of people infected between late January and late March, has revealed that while children aged 10 to 19 can spread the virus just as well as adults, those younger than 10 transmit it to others much less often. It looks like children overall have a transmission efficiency of about 50% of adults, although that varies dramatically across age groups, says Susan Coffin, an infectious disease physician at the Children's Hospital of Philadelphia. As children enter their teens, the transmission efficiency begins to approach that of adults. Potential reasons for this abound. Some have suggested that young children have. Back in April, the French epidemiologist Arnaud Fontanet found himself leading an investigation in the town of Crpy-en-Valois, a small community of 15,000 inhabitants just to the northeast of Paris. In February, the town's middle and high schools had become the center of a new outbreak of COVID-19. To view the full article, click the first link in the description below.